Hi everyone, my name is Jasmina Alajic and I'm the Accounts Manager here at Erchonia EMEA. Thank you for joining us on this enlightening webinar. Due to high demand for more information following Dr. Silverman's two-day workshop, here we are live with Dr. Rob himself. For those of you who don't know Dr. Silverman, Dr. Robert Silverman is a chiropractic doctor, clinical nutritionist, national, international speaker, author of Amazon's #1 bestsellers, Immune Reboot and Inside Out Health, founder and CEO of Westchester Integrative Health Center. The ACA Sports Council named him Sport Chiropractor of the Year in 2015. Dr. Silverman is on the advisory board for the Functional Medicine University and is a science officer with Neurodegeneration, chief clinical consultant for KBMO Diagnostics and Erchonia EMEA. A seasoned health and wellness expert on the speaking circuit and in the media. He was the principal investigator on level 1 FDA studies. We will be happy to assist you further at the end of the webinar, which for your reference will be recorded and sent out to all attendees. I would like to alert you to the question and answer box on the right-hand side of the screen, which you can use to type in your questions to Dr. Silverman. We will be addressing these questions at the end, but please type them in as we go along. Well, without further ado, over to you, Dr. Rob.
Thanks, Jasmina. I really appreciate it. I'm happy to be here. We had a great time. Wow, it's been about a week and a half since I was in London on Saturday and Sunday. A lot of great questions, a lot of hands-on protocols. So those who were there, thanks for coming, and those who are here, thanks for coming. I'm really excited about having a concise follow-up to decoding the link, sharing some advanced treatments for mitochondrial health, perimenopause, gut health, and of course, the insightful conversation of 2024 and beyond, longevity. So I'll break down and share some interesting factoids, fun facts, did you knows, and hands-on protocols that you'll be able to take back to your office tomorrow and or Monday morning. So without belaboring the point anymore, let's start talking about delinking the code. Always like to start everything off with a quote. I think this is an interesting quote and it really pertains to our subject matter. No matter your age, you can still control your health, your wellness, and without question, your longevity. Longevity, it's a great question. What is longevity? Well, longevity is obviously how long we live, but let's break it down into two concepts. Number one, lifespan versus health span. Lifespan is essentially the amount of years you live. Health span is the amount of years you live while you're healthy. But if we really get a little more granular, when we refer to the idea of health, it means living without a chronic disease. I can only share American numbers, but the last 18% of American years that they live are lived in chronic disease. Whereas in Europe, compare and contrast, it's still too long, it's 14%. So that idea of lifespan versus health span is very salient, if you will. I'd like to add one more theme. There's lifespan, there's health span, but it's also vitality. So at my age, at 58, what's vitality? Well, being able to go for a hike, being able to go to the gym, perform a quality workout. So it's not just being free of chronic disease. I would hope to stay free of chronic disease with all that we do within that idea of functional medicine / chiropractic, but also still being able to be vital, still being vibrant, not feeling my age and not attributing it to every loss of muscle fiber to aging. So longevity is lifespan versus health span, but really the goal is to have vitality in any years. I look at Mick Jagger. They just had a video of him performing, and he was running to run on the stage at 80 years old. So great longevity. Obviously, it looks like he has a good health span, and without question, tremendous vitality. So let's look at some of the hallmarks of aging that have been documented over the years. Number one, we'll talk about immune reboot, the idea of rebooting your immune system, pressing the red button. As you all know, I wrote a book in 2022 called Immune Reboot, the idea of allowing yourself immune health and allowing your immune system to be resilient. That's a key concept. Resilience in your immune system, variability, the ability to ward off cousins of viruses and pathogens. So your immune system is a critical hack. Now, interestingly enough, it has been stated that longevity is turning on the right health switches. I actually believe that the master switch to longevity is turning on the immune system or allowing for immune resilience. Inflammation. So there's a term, I usually use a slide that speaks about inflammation, i.e. inflammaging, where you're causing aging from the inside out. Inflammation, if I had a mantra, it would be to manage and modulate inflammation. I believe that many of my cohorts here in America and many of your population in Europe are pre-inflamed. COVID showed us that we were without question having a failing immune system, but also being pre-inflamed because of our tremendously inflammatory response to this new gnarly virus. The microbiome, another hallmark of aging. We talk about the gut microbiome. 80% of our immune cells are in our gut. It's where our macro and micronutrients are absorbed. The microbiome in our gut is the epicenter of our health. But the idea and the conversation of the microbiome has now expanded through multiple levels. The number one microbiome, as I just said, was gut. Number two would be gum. Number three would be skin. And there's also lung and genital urinary microbiomes as well. Mitochondrial dysfunction, the hot topic of right now. The idea that mitochondria is not functioning well really breeds the idea of long COVID and many of our other conditions, i.e. most predominantly neuromuscular skeletal injuries and neurological injuries as well. Fascial injuries, fascia is an interesting thing. It's the body's own saran wrap. It's the wetsuit of the body. So fascial injuries are interesting in that they're intracellular communicators. The best way to describe what fascia is if I could have you literally close your eyes and look at a chicken breast. You pull away the skin of the chicken breast, and between the meat of the chicken, the muscle, and the skin is that white film. That's fascia. That holds our body together. Like I said, it's a saran wrap. It's your body's own wetsuit. It's an intracellular communicator. Some other hallmarks of aging would be the vagus nerve tone. And I will show you an updated vagus nerve protocol with the laser. So much so that the vagus nerve is a conversation in virtually every seminar that you see pertaining to functional medicine and chiropractic. Vagus nerve, cranial nerve number 10, goes from the medulla oblongata down through the transverse colon. It is your rest and digest nerve. It's your wine and dine nerve. It is captain of the parasympathetic nervous system. Telomere shortening. We've all talked about telomeres before. The loss of muscle mass. Muscle mass is your longevity organ. It's your currency of longevity. It's your baseline on getting good quality muscle to fat ratio. So I'm a strong proponent of 50% of everybody's exercise programs consisting of some sort of muscle engagement, muscle hypertrophy, weight resistance, etc. Disrupting nutrient sensing, insulin signaling, mTOR, AMPK, sirtuins. AMPK is the girl with the curl. If it's turned on too hot, it's very deleterious. If it's turned off, it really doesn't promote enough muscle growth. So you really want to balance on mTOR. That's the only one that you necessarily don't want to turn on. You may want to actually dim and balance. Compromised autophagy, the body's own ability to break down cells, use the debris to make new cells. You want to break down these senescent cells, or if you will, a great nickname for these senescent cells which spew inflammation, which are zombie cells. A great way to get autophagy is the ketogenic diet. Probably the most common way, the cheapest way, the easiest way is to deal with something called intermittent fasting or time restrictive eating. So here are some of my longevity hacks. Number one, nutrition. Let medicine be your food, let food be your medicine. Hippocrates said that. It all starts with what you put in your mouth. You want to dramatically reduce sugar, starch, and ultra-processed foods. Exercise. Without question, you want to incorporate resistance training, a critical hack. Sleep. Now, there's nothing more rejuvenative for your brain than good quality sleep. Your brain shrinks to 40% of its size, literally taking a sponge and squeezing out all the metabolic waste. When you hit a good number of sleep, the right number in hours of sleep per night would be 7 to 9 hours. Health detectables and tracking. Two of my favorites, the Oura Ring. Do not own any stock in Oura, but an Oura Ring is a great option to take to track certain health markers. It actually tracks heart rate variability, which is interrelated with vagus nerve, respiration. The new Oura Ring also has a blood pressure check. And some other things I like to use for tracking is continuous glucose monitors. Lifestyle and mindset, I think that's the number one thing. I think everybody should wake up and start the day understanding that health is wealth. Intermittent fasting, or if you will, time restrictive eating, really shown to have a window of eating that allows for some caloric restriction. There was a great article yesterday that talked about myths of intermittent fasting. Intermittent fasting does not cause you to eat a bad diet. Intermittent fasting does not cause you to lose muscle mass. Intermittent fasting does not have any detrimental effect to any organs. If anything, intermittent fasting is a very salubrious lifestyle adjuvant. Breath work. I just had a great podcast. You guys can watch it next week. I had Dr. Sachin Patel on. We were talking about breath work. Did you know, speaking of breath work, that 70% of the toxins that you get rid of in your body is through your expelled air? If you want to talk about losing body composition or burning fat, 8.4 out of every 10 pounds of fat goes to a byproduct of CO2, which you expel out of the air. The other 1.6 is water, which you obviously excrete. So breath work is a great way to enable you to have a very health promoting moment. Purpose, mission, and community. Obviously, we want a specific mission, community, purpose. That's why we're doing what we're doing. This is lunchtime for me. This is dinner time for you guys. Hormesis. Our body responds to slight stresses, hot and cold exposure. So I'm a big proponent of saunas. Sauna with a temperature of 140 to 180 is the perfect temperature. If you go over 200 degrees, it damages the blood-brain barrier. And cold exposure, 50 to 59 degrees. Both, or I should say, hot gives heat shock proteins, generates heat shock proteins, and cold generates cold shock proteins, all very health promoting. We were made to be slightly stressed. Supplements. So what are the new big supplements? If anybody's interested, you could reach out to me. I think the supplement of longevity, or one of the keys, would be BPC 157, body protection compound. It's a peptide, which means that it's a string of beads of amino acids. It happens to be 15 amino acids, which is short of a protein. It has beneficial effects for gum, gut, musculoskeletal, and long COVID. And last but not least, of course, low-level laser, or as you guys like to refer, non-thermal low-level laser. So how does laser fall into the longevity march? Well, the real question is, could non-thermal laser be the answer, and why for longevity? Well, number one, it's not invasive. Number two, there's no downtime. Number three, there's no pain. Number three, it shortens your treatment time. It has pain relieving properties. It decreases swelling. It improves blood flow. It enhances energy production. It optimizes mitochondrial function. It's anti-inflammatory. It has immune boosting properties, promotes stem cell, neuroprotective, and it can downregulate stress responses in the brain. So laser energy actually fuels the mitochondria. Nothing stimulates the mitochondrial better than the proper wavelengths within the visible light spectrum to help mitochondrial function. So where does ATP get produced in the mitochondria? It gets produced in the inner layer. That is the site of electron transport chain. So this PowerPoint really will explain the idea of electron transport using high energy electrons to convert ADP into ATP. High energy electrons from NADH and FADH2 are passed along electron transport chain from one carrier protein to the next. When photons of visible light energy strike atoms, that energy may push an electron from the atom to a higher energy level where it can be picked up by an electron acceptor in an electron transport chain. A real takeaway here, and most of us are chiropractors, in that lower ATP, so mitochondrial dysfunction, not allowing production of ATP efficiently, those lower levels lead to hypersensitivity and also can lead to chronic widespread pain. So someone comes in with shoulder pain. Is the shoulder pain just from some rotator cuff injury, or is it from a more systemic attack of mitochondrial dysfunction not producing ATP? One aside, if you have any questions, put them in the chat and then we will definitely answer them as we go along. I'll do some hands-on and I will definitely answer questions at the end as well. So people always ask me, why do I use laser with a big why? Well, there are 5 reasons. 1, it's quite effective. It's using the speed of visible light. It's without question research driven. Erchonia has 22 out of the signature 25 FDA clearances in the US today. It's empirically studied. We have people out there like Max, my good friend Max Atkinson, who's just lighting the world on fire. I'm using an example. I'm putting you in the spotlight, my friend. I'm sharing it with you. Who's doing a great job? Ask him. Noel Campbell does a great job also. So there are people there already that have integrated lots of different lasers and are really getting the kind of optimization on patient outcomes that we all strive for. It's practice building. You know, you can't do the same thing every day and expect the practice to grow. So it is without question practice building. I'm always adding something. Every year, let's say, I add another device, another technique, just to further my ability to grow my toolbox for patient outcomes. Obviously, laser is going to be great in the musculoskeletal life for joint health. It's outstanding for brain health. It's also excellent for gut health. So what is low-level laser? What are some of the synonyms? Photobiomodulation, low-intense light therapy, non-thermal laser. The key takeaway, and this is what we always have to hang our hat on, it's photochemical, not photothermal. It is not generating any heat. Remember, photothermal can be deleterious to one's overall tissues or organs, especially a brain, which is very sensitive to temperature. So it's photochemical because light triggers biochemical changes within the cells. I typically like to compare it to photosynthesis in plants. It's photosynthesis in the body. That definitely stimulates the light bulb to go off in many patients. The idea is photons are absorbed by cellular receptors and trigger chemical changes. So to break it down into a nutshell, photons enter the tissue. It alters the cell membrane permeability. It allows for photochemical reactions, allowing the mitochondria to optimize ATP production, increasing metabolic activity, vascular activity, and decreasing systemic and localized inflammation. So what are my 5 major components to beneficial outcome? Many people will say, well, why is the frequency not there? Well, once the frequency is in, it is not a critical element. More critical is the specific wavelength. The 3 wavelengths that Erchonia offers are the red wavelengths, which is 635 nanometers, the 520 green wavelengths, and the 405 violet wavelength. Each have their own set of functions and properties. Then the dosage, milliwatts. You want milliwatts because you don't want too much power. Too much power will allow you to need a longer wavelength and will generate heat. So the lower the dosage, the better the ability with the proper wavelength for absorption. And to speak on probably the number 3, the delivery mechanism, the idea of coherent versus non-coherent, that is critical. Coherent means if I take a dart, I can get an exact bullseye. Non-coherent means that I'm throwing darts all over the wall. They're not even hitting the dart board. Movement. If you've seen me lecture, you see that I move the lasers often. And of course, the 635 or the 405 also always moving because they're scanning type of diodes. And lastly, pulse. Continuous is for body contour, pulse is for musculoskeletal. So here we have the impact of the red violet laser. So you're seeing indicates the therapeutic potency of red violet low level laser in the treatment of PAD. Laser therapy is equally effective for both men and women. So I really wanted to piggyback on the idea of coherent versus incoherent. Coherent is benefits of coherent light, enhanced energy transfer more efficiently between molecules, makes conversion into chemical energy, improves communication, Coherent photons facilitate communication between cells, acting as messengers that carry information and aid in absorption. Then you've got your direct effect, focused with great precision when leads to better therapeutic outcomes. And lastly, scientific evidence, robust data found that LEDs, light-emitting diodes, are significantly less effective than lasers in treating pain and inflammation. So that infrared red laser pales in comparison. So let's quickly go through the idea of the GVL. That's something new to the European market. It's a green and violet laser. It is without question the most energetic laser in the world today. You need 1.7 electron volts to allow electrons to jump to a higher voltage. So you need something below a 650 nanometer wavelength, red wavelength. When you get to the red light, past the red light, excuse me, and you get to the green light, you get 2.4 electron volts, and ultimately the violet light, you'll get 3.1 electron volts. So all of the lasers that Erchonia uses are in a proper wavelength to allow for a photochemical response, in addition to electron volt jumpage to stimulate different complexes in the mitochondria. The takeaway of this slide is, how does the body work, or how does the laser work systemic or globally? Well, there's free-floating mitochondria in the bloodstream that absorb photon energy and disperses it through. The laser works like a fiber optic network. It works through microtubulars, it works through nerves, and it works through blood vessels. So here's the mitochondrial complex. Complex 1 and 2 get stimulated for the violet light. Complex 3 gets stimulated by the green light. This is why the GVL is so unique and so required for mitochondrial work. And complex 4 gets stimulated by the red light. You need complex 1, 2, 3, and 4 all to be stimulated, and that's why I stack lasers together, because by getting all three wavelengths, we're able to have full mitochondrial stimulation. So some key themes, which we just talked about: 1 and 2 stimulated by the violet light, 3 stimulated by the green light, complex 4 stimulated by the red light. Each are a rate limiting step. You're not going to get the true mitochondrial function without utilizing all three wavelengths. This is a slide that I use. I haven't seen other people use, but I use this really to make the idea of functional medicine and laser quite evocative. So the violet light really is great for viruses. That's why I used it so critically and so effectively with COVID and long COVID. The green light also picks up the bacteria, and the green to red gets fungi and the red gets parasite. So if you have a GVL, you're doing a great job on viruses, bacteria, and fungi. If you need to get parasites, you need to have the red light. I wrote an article for Chiropractic Economics. It was a cover. It spoke about laser therapy for mitochondrial dysfunction, the use of low-level laser therapy across all three different wavelengths simultaneously is an exciting new development for treating mitochondria dysfunction. And lastly, here is better said, a slide referring to the FDA clearance for the Accelerate, the EVRL, and the GVL. And we also compared it to placebo, which we used in LED. So when people talk about light emitting diodes, understand it was used for placebo. So real simply, when you go across the board, it was about the same amount of patients in all studies. The duration of pain, or the time in pain, was most in the GVL. By far the most effective was the GVL in reference to pain. Secondly, EVRL. Thirdly, red. Paling in comparison was an LED, literally well below placebo. Because placebo, I love it when somebody says, I'm not sure if it worked, but I think it's placebo. That's 30%. I'll take it. And range of motion. So you see the LED really doesn't work well. The GVL, the EVRL, and the Accelerate all have stellar outcomes. So it's demo time. So it's time for me to turn on my camera. Look at that. And look what I have. Shocking. Have a seat.
Right here? Okay.
I've got Rebecca. Rebecca works the front. She's giving up her lunch. Actually, you are delaying your lunch just for everybody in Europe. And you guys are looking, so there's two different ways. This particular slide comes from courtesy of Dr. Trevor Barry and Dr. Dan Murphy, and I greatly appreciate their sharing. So what you see is, you see in the timing, the GVL is 2 minutes per area, the EVRL is 3 minutes, and the accelerator is 4 minutes. All frequencies are the same. My brain protocol is 1, 10, 13, 40. 1, 10, 13, 40. Okay. Within that, I'm going to do it a little differently because some people always want to say that I didn't hit the prefrontal the right way, the apical and the parietal and the brainstem. I do what we call the Elvis, and I do the comb over, and then I do the cerebellum. So what's the Elvis? Just let me punch in the frequencies here. Remember Elvis Presley? He got his hair cut in the Army. So the hair starts from the forehead, not just the prefrontal, but the whole spot, and goes back. Now I'm doing it real quick for demo purposes because I want to cover a lot of protocols. Jasmina, while I'm doing this, do we have any questions, or did I miss nothing yet so far?
We haven't got any questions so far.
Okay, that's great. Now the comb over, Jasmina will laugh. Remember, Jasmina, anybody on Tinder with the comb over, we're going to help them out here. So here we go. Comb over, comb over. And this is just to make it easy. I mean, I know the docs all know the different parts of the brain. And then I finish. So I do, because I'm using a GVL, I use 2 minutes back, 2 minutes comb over, 2 minutes at the cerebellum. Are there any questions on that? You can sit with me. Thank you.
Not yet.
I'm sorry?
Not yet.
Not yet. Okay.
Yet, yeah.
All right. So I put the frequencies up 1, 5, 10, 40. I actually am now using 1, 10, 13, 40. 13 is the frequency for the cerebellum. 40 is a huge frequency for Alzheimer's, big, unequivocal. 1 is delta, good for sleep, and 10 gets thrown in there because it's shown really to work great with the vagus nerve. So neurological conditions, new research, over 3.4 billion people throughout the world have a neurological condition. Included in these conditions are autism, Alzheimer's, and Parkinson's disease. You know, the concerning aspect is disability and deaths related to these conditions are increasing. They've actually increased 18%, and I think that's underpublished, if you will. Research is encouraging public health officials worldwide to invest in brain health, clearly. I just watched an hour special on CNN on Alzheimer's, and maybe, Jasmina, maybe we should write this down. Maybe we should have an Alzheimer's webinar where we share the protocol that they use. There's a Bredesen protocol and use laser. They didn't even use laser, and they're getting great changes in that they're slowing down and actually recovering from Alzheimer's if they get it early enough. So imagine if you change the lifestyle and the lasers, what you would get. I mean, that's a walk away. I'm packed with patients coming in with those.
Yeah, great.
So the Erchonia 405, I actually have the 635 in this room, but the 405 is something that we utilize. It has 4 different FDA clearances: lower back, plantar fasciitis, shoulder and neck, and oh yes, that's right, fungus. So the Erchonia 405 is a great choice. It has 4 different diodes. In that, it has 3 diodes on the red, which are scanners. I know you lost me. Don't worry, I'm aware. So I'll just sit here while I go laser myself. So I'm using the 635. I'll show you a key takeaway on this as well, 4 FDA clearances. So I do a lot of brain lasering of the brain. So all positive effects on photobiomodulation, non-thermal low-level laser for neurodegeneration. It'll show an increase in anti-apoptosis, meaning cell death, decrease in plaque formation, Mitochondrial preservation. The number one mitochondrial part of your body is your brain, antioxidant capacities, and anti-inflammation. Some molecular mechanisms of transcranial low-level laser therapies: angiogenesis, synaptogenesis, the growth of BDNF, brain-derived neurotrophic factors. They are protein enzymes that come from the gut that get to the brain to allow for brain neurogenesis and increased neuroplasticity. So your brain can grow or regrow nerves, so your nerves can fire together, therefore they can rewire together. It also decreases neuroexcitotoxicity. Neuroexcitotoxicity is interesting in that it decreases a lot of aberrancy in the brain. It shuts down the synaptic cleft and doesn't allow glutamine to get into the brain to cause aberrancy between potassium and calcium and cause plaquing. It also shown to decrease brain edema, inflammation, and once again, apoptosis, like we said.
We have one question there for one of our attendees, and he's asking, are there any contraindication of this laser treatment, for example, pregnancy, breastfeeding, or certain medication?
Great question. So the answer to the pregnancy is yes. Now, there's several laser groups that say that they laser patients that are pregnant. The reason is that no one has done a study on pregnant women, and especially in America, everybody's quite litigious. Do I believe if my wife were to be pregnant, would I laser her? Yes. Do I laser pregnant women in my office? No, I would avoid that. Yes, I understand why you're asking about breastfeeding and medication, because I think warfarin is in the manual. I still haven't figured out why it's there. I see no contraindication to that. I don't see a contraindication to breastfeeding. Jasmina, have you heard any women that are breastfeeding not being able to get lasered? I mean, I know it's in the book, the manual. I think the manual may just need to be updated.
Well, it all depends. Well, some practitioners will use the low-level laser energy on a pregnancy. Some won't. It's just up to the doctor's discretion to decide. But we all know it's quite safe.
I agree. I mean, even the pregnancy, but I don't because of, again, I live in New York. We live in a litigious society. So no modalities. This is a device. It is not a modality anymore on pregnant women, but you notice my body movement to that. So,
and I've got another question, and saying, how many treatment sessions is recommended for a person before they notice an improvement in their physical health?
There's been the wow factor, the home runs in one, they've seen it, but you don't always get the one. I'm always telling everybody they'll be 50% better within 6 to 8 visits. Now, you also have to express that that they may get better after the treatment because of that systemic global effect with the microtubulars, the nerves, and the blood vessels, because mitochondria is free floating in the blood. This may occur 2 hours later, 2 days later, because studies have shown with Erchonia lasers that have got an FDA clearance, for instance, in the lumbar back, that there was still a year after cessation of laser therapy, there was a decrease in pain of 18%. Any other questions? So I can't see the questions. So
yeah, that's all for now. That's all for now. Thank you.
Not to be funny, but symptoms on patients in dementia, laser therapy could be a promising treatment modality for people having dementia. Obviously, dementia is usually associated with Alzheimer's. Parkinson's disease. So this was only done to the brain in the Parkinson's disease. So there was a statistical reduction in VAS, visual analog scale, for gait and cognitive function. Gait had a 30% improvement, cognition 38%. Also, difficulty in speech was lowered by the study's end. Interestingly enough, with Parkinson's is an autoimmune condition that's bidirectional from the gut to the brain. When I deal with Parkinson's patients, I laser not only their brain, but I laser their gut, I laser their vagus nerve, and within all that and changing their diet around, the outcomes, again, we slow the stoppage. When I say slow the stoppage, slow the slippery slope towards Parkinson's disease and getting worse. And we're also able to bring it back and retract some of it. So evaluation of low-level laser on symptoms in Alzheimer's disease. So this specifically, the last bullet is most critical. Prior laser trials have shown beneficial clinical effects for other neurodegenerative disease and neurodevelopmental disorders such as Parkinson's, Alzheimer's, and autism. So you're really seeing a lot of studies coming out on any kind of neurodegenerative disease. So that's what it looks like. Come on, let's mimic them. Right over here.
Okay.
So it's easy as and so this 635 to 405 has the violet light, and if you wanted to stack, so I use the 635 red light. I'd stack it with the GVL where I get the purple and the green light. So you can do it with the 635 or the 405, getting all three wavelengths. We call this stacking. This is stacking at handheld to 635. I'll let that lay for a while. I'm sure they're going to have a question on that. Guys, no questions on that? You know what? Give Jasmina, give me a thumbs up if you like what you see. This way we know we're interrupting your dinner, your tea, and your biscuit. By the way, guys, it's not a biscuit, it's a cookie. We'll get to that. We'll get to that. Are we good? I'm just going to let her go get a brain laser. She could use it today.
Amazing.
The most effective clinical outcomes across all disease spectrums can result from the normalization of gut function. Everybody in my office gets their brain lasered and their gut lasered no matter what condition they have. So
Yeah, I was just going to ask that questions. Will that benefit more if we laser the gut at the same time with the brain?
Mm-hmm. So what you would do is, I'll just take another handheld or you could utilize your emerald. Everything I'm doing up here, you could utilize with an emerald as well. So I laser their gut. Can everybody see that I have another handheld laser?
So we obviously have a lot of clinics who've got the emerald laser, which is the green light, and also the EVRL, which is the red and the violet light. It will be beneficial for them as well, just to have all those three lights together for optimum health and wellness to offer for their patients.
So obviously, if you're able to normalize gut function, you're going to be able to increase longevity. So, okay, so we got you up. Thank you.
No problem.
So photobiomimics, I wrote an article. Jasmina can share that article with you. I think it came out about 12 months ago. It talks about the idea of how the photons affect the microbiome. So laser light can affect the microbiome indirectly through daily circadian rhythm, the matching with you and your imaginary clock, if you will. There was a tremendous favorable improvement in gut bacteria 400-fold using the laser versus placebo. And remember, the placebo we use is an LED. Significant difference in microbial diversity between a real laser and the sham laser. So if you want to change your ecosystem, lasering the gut is a great way to start. So the violet light is really one of the big takeaways. That's part of the GVL and the EVRL and the FX405. So the violet light actually decreases bacteria species of aeruginosa, gingivitis. One number on gingivitis that really grabs me is that 90% of Alzheimer's patients have gingivitis, and they've got the enzyme from gingivitis called gingipans. H. pylori, which a couple of patients just recently came in. That's real rough to get, and Staph aureus. So the violet light exerts an antimicrobial activity. It also breaks up biofilms. Biofilms are bacteria igloos. They're like plaque in your mouth. So these igloos protect the bacteria. So one of the great parts about the violet light is it breaks up the biofilm. You match it with something called serum bovine immunoglobulins, which is the mop of the gut. So now you've opened up the biofilm, and now you mop away the particular bacteria. Interesting that 80% of bacterial infections in the gut have a biofilm. And here again is the 405 showing specific antibacterial activity. Vagus nerve demo, the perfect 10. So,
I just wanted to just drop one question here from one of our attendees, and is asking, is Erchonia's Parkinson's and Alzheimer's research with laser only?
correct. I'm giving you my research. When I laser to the brain only with those great results, I am sharing with you what I do in my office, which is laser, gut, vagus, and robust nutrition, which even increases and improves on the outcomes. So the laser is a great standalone device. When you integrate it with other types of treatment protocols, it really exponentially increases. So it's quite exciting. And people ask ROI, how do I pay for it? Well, you're going to pay for it by outcomes and treatment, but you're also going to pay for it in the fact that you can increase aesthetics, but you're also going to pay for it because you can increase like a nutrition line as well. I mean, Jasmina, you live in the aesthetic world. To fix somebody's gut, to allow them to digest their foods so they're not hungry all the time, makes it a lot easier to take off a few of those pounds and then get on the emerald. You know, you've now got a real synergistic 1-2 punch.
Yeah.
Okay, so vagus nerve, medulla, and let me know if you can't see me. You know what? Okay. Put the chair away, so don't try to sit down.
Okay.
That was a joke.
Yeah, that's great.
I'm a little nervous, by the way.
Okay.
Mira, chica, mate. So medulla oblongata, down through the transverse colon on the right side, 3 to 5 short, quick passes, usually takes 30 to 60 seconds. I'm doing a little quicker for demo purposes. Then when you're to the bottom of the right lower quadrant, you're gonna laser in this manner across to try and get the migrating motor complex and the ileocecal valve. Then you're gonna come back up to the foramen and put the laser in the foramen for 30 seconds. And then you're gonna go to the right auricular portion of the vagus nerve. You're gonna put it in their ear. This part of the nerve is 1/100th the size of the vagus nerve, but has more nerve fibers than any other part. What I'm doing right here is great for anybody on the spectrum. So this is a great move for autism. And finally, there are some fibers that come to the right prefrontal cortex. So 3 to 5 passes, right lower quadrant, foramen, ear, auricular portion, right prefrontal cortex. Come to the left side, little different, medulla oblongata, down through the transverse colon, up and down again, 3 to 5 very quick passes, into the jugular foramen and into the left ear canal. No left prefrontal cortex. And then we end, believe it or not, with the spleen. The afferent going up, the efferent coming down are anti-inflammatory pathways. So the vagus nerve is very anti-inflammatory. Stimulating the spleen decreases inflammation that the spleen gives out. It releases acetylcholine, which blocks TNF alpha. And therefore, there's 3 pathways that the vagus nerve make the body anti-inflammatory. Also enables you to have better breath work because it works with the phrenic nerve. So those 2 nerves also work with the diaphragm, the phrenic most predominantly with the diaphragm, and taking a better breath. You know, we take 233,000 breaths per day. So when you stimulate the vagus nerve, balance it, and work with the phrenic nerve to make a more efficient breathing, you're really helping the person systemically. Any questions on the vagus nerve? 10-10-10 is not just its It's not just a 10 because it's fabulous. Those are the frequencies.
And for how many minutes would you recommend to laser the vagus nerve for?
It's probably going to take you a quality 3 to 5 minutes to go through the whole program.
Yeah. I've got one question. Would you use the laser on the oral microbiome?
All the time. I'm the guy who's got gingivitis. I sit, and Jasmina knows, she rolls her eyes. Oh, Rob's coming here. What vegan, organic am I going to have to go eat in? Okay, great. He'll have some sushi, but he won't have any rice. This guy's a load of fun.
Yeah.
I mean, and I've got gingivitis. I've got a genetic marker for gingivitis. So, yeah. And there are lasers being used in dental offices that are hot lasers. Check this out. We want to talk about incongruent. Their lasers like over 1,000 wavelengths. I went to the guy. He wants to burn away the membrane, retract the gum to allow it to grow back.
Mm.
My teeth will fall out. I'm already long in the tooth. Whereas now I've been using the green light, the green and the violet light, and my periodontist said, you know, I'm really surprised at the response that you've got. I'm going for another checkup. And there's some studies being done in America, can't go into too much detail, utilizing these lights on gum structure because the gum is a microbiome. As a matter of fact, your mouth is the dirtiest part of your body. So that's a great question. So key laser protocols for musculoskeletal injuries, chronic lower back. So I'm going to go here. Jasmina, just make, since I can't see my camera, let's see if we can get.
Yeah, and Dr. Silverman, how would you point a laser when you want to use it for oral microbiome, through the cheek, or you just open the mouth and directly laser yourself in there? Yeah, that's what I thought.
Or you can really get it in the mouth also.
Yeah, I do that myself as well.
Absolutely. If I'm lasering the gut, why wouldn't I laser my mouth?
Yeah.
I mean, the skin is a great idea, but the skin covers a lot of terrain.
Mm.
So lower back. Can you see? Jasmine, is it clear?
A little bit only. Maybe if you can lower the camera a little bit down so we can see it better. Yeah, that's perfect. Great.
And I'm coming, she's doing her back. I would come in and laser her brain. Any questions on that? No, we're good? Okay.
I guess everyone's happy till now.
All right.
Well, if you have any questions later on, we are very happy to answer those ones for you. Just let us know.
I'm going to open it up for question and answer because we've got a few minutes left. So real quick, if you're interested in following me, social media is growing. We had 2 weeks ago a tremendous amount of reels. I had one of the other speakers on with me. I'm going to have Simon come on next month and do a podcast. Don't worry, I'll make sure his answers are short, tight, concise, epigrammatic, all of that. And just take a picture, join me, follow me on Instagram, Facebook, and on my podcast, Proven Health Alternatives. Whoops. Also, I have a laser group where we answer questions. We're usually answering 2 or 3 case studies per day. Take a picture, Dr. Rob's Master Laser Group on Facebook. And I'm going to open it up for questions. I'm going to get Rebecca up. So if I need a model, to take care of it. So now's your time to populate the questions.
I just got one question. It says, Were all patients in the studies given specific dietary regimes that fully supported recovery of the specific affection?
Only in my office. Erchonia never does anything with nutrition because of the laser outcomes. Only in my office. I mean, it may be other practitioners' offices as well, but I'm giving you Erchonia's results, and then I'm telling you they get even better as you add some nutrition, typically.
Just waiting on other questions. I think that everyone is interested in a webinar regarding the Alzheimer's, the one you mentioned before. So we are going to look something in the near future.
Yeah, we'll book that. That is actually a hot topic, especially with the CNN special sharing with Dean Ornish's. So I have reticins, Ornish, so I have the combination of that, the exercise rehab, because exercise or brain rehab, if you will. There's some apps online. It may be needed to be 90 minutes, but we'll take it from there. I'll get all the lasers in one room.
Yeah.
Guys, ask questions. Feel free. I allotted 10 minutes and I was a little short on that. I only got to 6 minutes for questions, so feel free. Jasmina, what's the most common question that they ask you about this?
In regards to?
In regards to the pain lasers and, the FX, the GVL, etc.
Well, the patients would normally ask regarding different kind of conditions and how to treat different conditions, which I normally direct them to yourself.
Okay.
Any questions onto your Facebook group, which is great. I think there is a lot of very helpful people there with lots of experience, with the ones who own lasers as well, which is very, very helpful.
Yeah, and that's why we want it on the group, because there's other people that'll learn from it, other people that'll chime in. There's a lot of master laser owners in the group, so that would be great. Couple of real quick things. There's been more failure by the attempt at perfectionism and than anything else in failure itself. People wait, they're worried, they're this, they're that. If you're not sure what to do with the laser, press the power button, point it at the patient and move on. That's going to be about 80%. The laser on its own, without switching the frequency, is 85% minimum right there already.
And I've just got one question, says anything on fibromyalgia?
Yeah, fibromyalgia, more commonly in women. Fibromyalgia is an autoimmune condition that damages the dorsal root ganglion. So I usually laser the gut to start because it's autoimmune. And I'll laser the nerve pathways that are involved in the individual's fibromyalgia because of the dorsal root ganglion. And I'll use two different frequencies, 4933 60. 60, I just repeated to myself, and peripheral nerve 2222, 4 2s across the board. Deuce is wild, as I call it.
And any gut setting for oral mucosa?
My gut setting, my master gut, Dr. Rob's master gut is 44926.
Yes, it's the same one, yeah.
Yep, 44926.
We would normally preload all those settings into the lasers when you purchase the laser.
Ladies and gentlemen, your preloads have 98% of anything you're ever going to need. And the most important question, or the most pressing question everybody asks, what's the frequency? It's probably in your presets.
Yeah. Yeah, I mean, most of them, they do come with a vagus nerve, they'll come with a gut protocol, brain protocol, just the basic one, just like you just said now, the ones you would probably use them most of the time.
Yep. So let me know, any other questions? They're quiet today.
When would you use high settings?
So somebody notices that I don't use a lot of high settings. So a high setting would be over 50. I don't like them over like 200 or 300. High settings are more for chronic settings as opposed to acute settings. So I don't use a lot of high settings.
Well, great. I think that we don't have any more questions here.
Everybody have a good dinner.
Yeah, well, probably we're just about to cook now.
Okay. Enjoy your supper.
Yeah, well, great. It was a wonderful webinar. I hope everyone enjoyed it. And thank you very much, Dr. Rob, for hosting this webinar and for those of you who have attended. And don't forget, the recordings of this webinar will be sent out to all the registrants. And if you have any questions later on, which you can't remember now, I understand that, you can always drop us either an email or a message, and then we're here to answer those questions for you. Well, have a great evening, everyone, and thank you for tuning in.
Thanks so much. See you soon.
Bye-bye.
Bye-bye.